The tibia, right-sided tibia, Latin in shin bone, medial, larger bone of the leg, shape prismoid in shape, side determination. The broad upper end faces upward, tibial tuberosity and sharp anterior border looks forward. Medial malleolus projects the medial side of lower end helps to determine side of the bone. Features of tibia: upper end sharp and lower end. The two condyles in upper end, intercondylar area, tibial tuberosity, medial condyle. Medial condyle is large to lateral condyle, oval in shape. Superior surface articulates with medial condyle of femur. The articular surface is oval in shape. In medial condyle, posterior surface has a groove. Lateral condyle is smaller than medial condyle. Superior surface articulates with lateral condyle of femur. Articular surface circular in shape. Posterior inferior aspect of lateral condyle has fibular facet is present. Intercondylar area, roughened area on the superior surface between two condyles. The two articular facet of condyles in between narrowest middle part, intercondylar eminence, which flanks by medial and lateral intercondylar tubercle. Tuberosity, anterior aspect of prominent tuberosity present in anteriorly. Tibial tuberosity, upper part smooth and lower part is rough. In between upper and lower part, epiphyseal line is present. Sharp border, three borders, three surfaces: anterior border, medial border, introosseous border. Medial surface, lateral surface and posterior surface. Anterior border, sharp anterior border, S-shaped from tibial tuberosity above to anterior border, middle malleolus below, subcutaneous and forms seen. Medial border is rounded border from medial condyle above to posterior border to medial malleolus below. And introosseous border, also called as lateral border, it extends from lateral condyle above in front of fibular facet and anterior border of fibular notch. Extends from anterior border of fibular notch. This is fibular notch, anterior border, posterior border. Surface, lateral surface and posterior surface. Anterior border, sharp anterior border, S-shaped from tibial tuberosity above to anterior border, middle malleolus below, subcutaneous and forms seen. Medial border is rounded border from medial condyle above to posterior border to medial malleolus below. And introosseous border, also called as lateral border, it extends from lateral condyle above in front of fibular facet and anterior border of fibular notch. Extends from anterior border of fibular notch. This is fibular notch, anterior border, posterior border. Medial surface in between lies between anterior and medial border. Introosseous or lateral surface lies between anterior and lateral border. Posterior surface lies between medial and introosseous border. In posterior surface, in upper part of there is a crossed line. This is called a soleal line. Extend from behind the fibular facet, runs downward medially and terminate into medial border at the junction of upper and middle thirds. The lower end. Anterior surface, medial surface, lateral surface, posterior surface, and inferior surface. Anterior surface, upper smooth part and lower rough part. Medial surface, subcutaneous, continuous medial surface to medial malleolus. The lateral surface has fibular notch, form inferior tibiofibular joint, and posterior surface shorter than the anterior surface. The inferior surface articulates with talus bone and form ankle joint. Attachment of tibia. Upper two-thirds surface of the lateral surface. It is tibialis anterior origin, upper two-thirds of lateral surface. The medial malleolus. It is insertion of semimembranosus soleus muscle originate from soleal line. Upper part of medial surface, it is insertion for sartorius, gracilis and semitendinosus. Popliteus inserted into posterior surface of triangular area. The posterior triangular area insertion for popliteus muscle. Medial area of posterior surface below the soleal line. So, medial area of posterior surface below the soleal line, it is origin for flexure digitorum longus, and lateral area origin from tibialis posterior.